Joey, we have a few less people connected at this point, but it looks like there's still some people coming in from the waiting room. So I don't know if we want to get started or wait just a minute until we feel like we've got most people included.
Sounds good. And Julie, you're sharing your screen, but it's what I see is a big video of me versus the agenda. So I don't know what everybody else sees.
You don't want to see that? Okay, I will.
I see the agenda.
I see the agenda. It might just
Okay,
be
perfect. Maybe it's just on my end then, so I will not worry about that.
Okay.
So yeah, we have about 45 people on, and I know we have about an hour and a half, and we do have a pretty full agenda. So if everybody is good with it, we can go ahead and get started if that's okay. Sounds good. Okay. So again, welcome. We are on to our, what is this, our 7th or 8th provider stakeholder updates. So I hope everyone is having a great summer so far. We again have a full agenda with a lot of wonderful workgroup updates. So looking at the agenda, is there anything that you see here that you think we need to edit or add perhaps? Okay, hearing none, then what we're looking for is somebody who can assist us as a timekeeper and then also a chat box monitor. Is there anybody who'd be willing to take on either of those roles?
I can keep time. This is Donna.
Thank you, Donna.
And I can monitor the chat box.
Thanks, Tyler. Okay, if there is nothing new to add to the agenda, our meeting agreements have not changed, so those remain the same. And we'll go ahead and turn it over to Julie.
Okay, so the we only really have one follow-up item, and it'll be brief because we do have Q&A sessions coming up tomorrow for the extraordinary needs funding training. DSS, Office of Medical Services, will be present on those Q&A sessions, and so they bring any questions you have regarding Medicaid billing, coding, interactions with the medical or dental providers, DME providers, etc. And they will do their very best to answer those questions. And other than the only other things that we really had on our action plan were, extending the meeting, which we have done. And we also included the work group updates on the agenda. So the other action items are already built into today's time. So that's the only update I have today.
Perfect. Thanks, Julie. So just a couple updates from me then. As far as the continuum of care, so the RFP process is complete. The agencies that were selected have been notified. So we anticipate that we will have further updates in, I would guess, the next coming weeks as the contracts and whatnot get worked through. So that's what we know as far as the regional centers as part of the continuum of care update. I just also wanted to provide an update on specific to the Division of Developmental Disabilities. As you guys recall, we've created some focus areas based off of the Continuum of Care report that was submitted to the state by Align. And so I just wanted to share briefly that we continue to work on that. Those focus areas, we recently met as a team to identify some additional goals and strategies within that. So we continue again to keep that in the forefront of the work that we are doing. Any questions on Continuum of Care? Okay. The next item is Appendix K, an executive order. So the Appendix K, as you might recall, CMS gave an extension of 6 months post public health emergency ending. And as of right now, the Biden administration has declared that the public health emergency would end as of July 14th. So we're watching that closely. If that does not change, then that means we have 6 months from that time frame, which I believe moves us into January. if I'm counting that correctly. And so we're just, again, watching that closely to notify or to make sure that we're keeping in line with what's the expectation there with Appendix K. Executive order. So as you recall, Governor Nome had extended the executive order to June 30th. The executive order will not be extended beyond the 30th. So we are working internally to provide some guidance on the flexibilities that were included in the executive order and how do we unwind from those. So you will be seeing that, I would guess, in the next week. Within the next week, you'll have that guidance. Any questions on either Appendix K or the executive order?
Joey, this is Shirley. So providing day services in residential, is that covered under Appendix K, or was that covered with the executive order?
I believe that that was covered in Appendix K.
And that would go till January then of 22?
Yes, yes,
Okay,
that is correct,
thank you.
Shirley. Great question. Any other questions? Okay, then last brief update from me is regards to the FMAP, and I'm assuming that's the enhanced FMAP. The ARPA, the American Recovery Plan Act, we requested from CMS an extension and they granted that to South Dakota. We will be responding to that, and they've granted us till July 12th is the extension that CMS gave the state of South Dakota. So all agencies with HCBS waivers are working with DSS to create a narrative and summary to submit for approval on how we would like to utilize that enhanced FMAP. So in the next week, we will have that work completed. And I can certainly, I can't see, I'm assuming Dan, is Dan on?
Yep, I'm here. Yep.
Okay, perfect. So then Dan, I will send you an update as soon as I know if what the next steps are with that after we meet with DSS in the next week.
Okay, sounds good.
But yes, we will be pursuing it, and CMS extended to July 12th.
So, and they just extended like just whatever the proposal is for how you're going to go about utilizing the resources and stuff like that.
Yes.
Okay.
Okay, any other questions on any of the updates I just provided? Okay, hearing none, I will turn it over to Julie and Jays.
Okay, so I'm sharing the agenda right now. If I click here, can you guys see the memo now? Did it switch over? Excellent. Okay, so we issued this memo on June 4th with three kind of main areas of guidance and clarification for some issues that had come up during the FY21 review cycle. And so knowing that it's been a couple weeks now, just wanted to provide an opportunity for any questions that you might have regarding the points in this memo. So kind of opening up the floor and of course, welcoming Jays to chime in with those responses as she's able as well.
I have a couple of questions. The first one in relation to the DD 717 provider choice and service choice notice. During our policy implementation review, I thought we got kind of cited for not having that annually. On here, it says we only need it initially with the level of care for the, so I just wanted to verify.
Amy, Carrie and I did talk about the LifeSpeak review yesterday briefly. I've not had a chance to go back and look at those specific those record retention files, and it's been a little while, so I'm going to need to go back and look at those specific findings and records that I reviewed.
Okay, so
we'll follow up with you. I think she's going to be there in the next day or two, right?
well, and I'm not so concerned about the our policy implementation review. I'm looking at this document on page 2 where a policy implementation, and the 717 isn't included for annual, it's only initial. I just wanted to verify if that's correct.
Yes, that would be initial. So and Jays, again, feel free to chime in. One, the 717 has been used by providers to issue the service choice and provider choice. The intention of that form at the time of initiation of services, it's a two-sided document, and it is really institution choice. And on the backside is the fair hearing notice. And those rights are outlined. There is a little snippet of information on the institution choice side that mentions I've been given a list of providers and services available, and so that has been used, I think, pretty commonly in the last 5 years as that provider choice and service choice, along with like a brochure. But with the record retention specifically, we're looking for the institution choice notice provided at the time of eligibility and admission into services. Does that make sense?
So,
Julie and I now realize, is that message directed at CSPs or at case management?
this came
So-
to both providers.
Right.
Yep, scrolling a little bit so you can see it better.
And the paragraph says both providers are responsible for all of these.
And why is that?
Because of the way the rule is written, it does not distinguish. It says the provider is responsible. And so it doesn't say the case management provider, it doesn't say the direct support provider, it says the provider. And our rules are pertinent to both provider types.
But it doesn't mean we both have to do them, right? It just means that we both
Correct.
have to retain the record. So if the
Correct.
case manager does the 717, as long as we as a CSP provider have that in our records, we're covered.
Yes,
Is that correct?
yes, that is correct.
But with
So,
the rule rewrite, couldn't you just put conflict-free case management provider?
Technically, yes, if we get that feedback from the association that that's a rule that they would like us to consider.
Julie, and Amy, thank you for asking that. Looking in waiver, the 717 is an annual document requirement.
It is annual in waiver? Okay, my mistake.
So I totally overlooked that and missed that piece. I apologize.
Okay,
So
so
we will,
we'll correct that.
And then my second question related to documentation of service delivery and what that would look like on the case manager side.
I would envision that as case notes.
I didn't catch that.
Oh, sorry. I said I would envision that would be case notes, would meet that expectation.
Okay,
Jays, would you have anything to add?
no, I think that would be appropriate.
thank you.
All right, what other questions?
This is Shirley. I have a question about needing to send our policy to the division before we send it to our board of directors.
So, oh, go ahead.
I'm just curious why that has changed.
So the reason that we want to look at it before the board of directors approves it is to really hopefully simplify the process, because if you take it to a board meeting and they approve it, and then you send it to us and we find that there are components missing in that policy, you then have to revise it, give it back to us, give it back to the board, and have them review it and approve it. So in hopes that if you write the policy or revise a policy, you send it to us, we approve it, you send it to the board one time.
So, so any policy revision during our 2 years between reviews, we need to submit to you.
If it is a policy outlined in 4604 or 4611, yes.
Okay, and what will the turnaround time be, and what will the documentation be that you've already reviewed that policy? So when it comes time for our review, it's already been approved.
It will be entered in SMART, just as we do now, as an ongoing policy review. And we would review that. And honestly, the turnaround time would much likely be faster if we get them as they are revised versus one larger package. And the remediation time would be 10 days, just like it is now, if we find that there are components missing or incorrect. And so once those are remediated, we would submit that policy review to reports, and we would be able to go back and verify which policies we've received in that 2-year time frame.
Yeah, I think the key thing is that the division need to be reviewing and approving policies prior to them being implemented. And so what we had identified is that we were getting policies after the fact and then identifying issues with them, which would not be in compliance with administrative rule.
So we just had a review, and in order to get on top of our OIGs, we're going to be reviewing OIGs on staff annually. That was a directive. We changed our policy. We took it to the board. But now, in the future, if there's a policy, something that comes up during a review that we're going to change, we'd send it to you. And it wouldn't be implemented yet, but we'd still be under a timeline.
Yes, and so it wouldn't necessarily have to be, what I heard you say, Shirley, is if you're changing something as a result of a review, that's correct. You would still, that's remediating the policy basically. But if let's say from now until your next review, you decide to change something in your drug screening policy, I don't know, I'm just making something up. If you just decide to tweak something in that policy, you would want to submit that to us before it goes to your board to make sure that it meets our standards. And we would complete that review. Again, we would do that in SMART and approve it. And that would serve as the documentation of a policy that we had reviewed in between, like during that certification cycle.
So basically, our board would just be a rubber stamp.
Well, I think what's not in here is the ability to still submit in draft to the review. It's that, or to the board, I'm sorry, it's that final review and approval where we're talking about for rule in this instance. It wouldn't be, surely, that you wouldn't communicate with your board, however you do when there's a possible policy change, even going so far as sending perhaps the draft language to them. But what we needed to change in order to move into full compliance with rule was that final review and approval by the board should come after DDD has reviewed and approved.
Okay, other questions? Okay, hearing none, then we will.
Julie, you muted yourself.
Whoops, sorry about that. I meant to just change over to the other document. So hearing no other questions, we will keep moving through the agenda. We have included work group updates. We've allowed about 10 minutes for each. So we won't be able to go into like a lot of depth and detail for each one, but we'll do our best to give an update and field any general questions about each one. I will talk a little bit about the Life Course Nexus work groups. So we have the Support Coordination Foundational Training and the ISP Tools and Guidance. There are 2 groups within this effort. The Support Coordination Foundational Training, those work group members are going through each of the 6 modules one by one and providing feedback on both the functionality of the website, if it's user friendly, any recommendations about South Dakota specific content, and just providing general feedback about content, what would be helpful moving forward as we look forward to implementing that online web-based training module. So a couple of the recommendations that have been made is to develop a facilitator guide for those who are responsible for training case managers and support coordinators. So, we're not relying solely on those 6 modules because it really is foundational knowledge. And so we want to make sure that we're supporting you all as providers to build that internal capacity to continue training, to have the knowledge internally and not rely on DDD or out-of-state trainers or, those external entities. We want to help you all develop that internal capacity to provide that training and development for your staff. So that facilitator guide was something that the work group members suggested that would be helpful. Another comment was that there is some mention of trauma-informed care in one of the modules, but it really doesn't go into a lot of depth and detail. So part of the facilitator guide would be to add some resources that would be available in Open Futures Learning or Relias or some of those other learning platforms that are commonly used. So those are kind of the highlights from the foundational training portion of that work. And then, so let me pause for a moment. Are there any questions or comments about that specifically? Or anyone who is part of that group who would like to contribute or add? Okay. The one other thing I would probably add about the foundational training is that we did a little bit of level setting in one of the early meetings, just talking about the role of a case manager, the role of a support coordinator, and facilitating that conversation, with the people we support and their families. And we don't always have all of the answers when we're trying to complete a PCT tool or a charting life course trajectory or an integrated support star. We don't always have all the answers, but it's really about how do we help people in that case manager and support coordinator role gain those conversational skills to facilitate that conversation and glean information when you're just talking with someone, to be able to kind of fill in the blanks. So that was another component of that work group discussion. The ISP Tools and Guidance group has met twice now. And so the first meeting was really just kind of level setting again, the purpose of the group. We looked at various resources, administrative rule. We looked at the Choices ISP guide. We looked at some examples of ISPs from both the Isp templates that we use in Choices and the Focus format that we use in family support. And then we met again just on Monday. And so the Life Course Nexus folks who are leading that group created a crosswalk of administrative rule, PCT and charting the life course, and CQL, which included both basic assurances and personal outcome measures. So that was a really nice resource that kind of, it was a little bit overwhelming to look at all at once, but I think it does a nice job of connecting the dots. And so I think that'll be a good resource moving forward. that they did create an ISP template. And so when we say ISP template, that doesn't necessarily mean that we're all getting a new ISP. It's really just kind of a different, it's just a template that we're testing out. And it incorporates charting the life course, life domains, and asks kind of some exploratory questions in each of those domain areas. It collects some of that demographic information that we know is necessary to successfully support people. And so moving into our July meeting, we are in the process of, I guess, recruiting people to pilot this ISP template in August. And that includes family support coordinators and choices case managers. So we're collecting names and doing a little bit of outreach to people who have ISPs that are already happening in August. So we're not expecting people to do like an extra ISP or anything like that. We're building this in to our current processes and procedures as much as possible. So that's kind of the phase we're in. And then in July, we will pull in those volunteers who will be piloting the template and doing kind of an orientation so they know the expectation and kind of can have a chance to ask questions before they pilot that. And then from the pilot, and oh, I should mention also with the pilot, we'll be creating like a guide to go along with that template, so people are not, you know, going into ISP meetings with a template and, you know, just kind of winging it. Those are the high points. Are there any questions or anyone who would like to add to anything I've mentioned?
Are you going to be sharing the crosswalk? That sounds wonderful.
Yeah, I think we could share that crosswalk. I will probably take another look at it because we just met on Monday. I don't think it's in draft form or anything. I think it is probably ready to be shared. Okay. All right. Well, if there are no other questions or comments, I will turn it over to Jays and Joey to talk about the HCBS settings work group.
So the HCBS settings work group, we have met as a full work group 3 times, and 1 subgroup meeting has also occurred. Largely what we've been focusing on right now is just getting a good understanding of what the requirements are of assessing the HCBS settings, looking at a process to make sure that CSPs have access to previous assessment results. We've also talked about creating an assessment process that we can use now, which includes timelines, not just for the self-assessment, but also for case management's assessment that needs to be completed, as well as the division's assessment. So we've got that all worked out. We've also started looking through and identifying what makes sense for if there are any policy changes, what that timeline might be. And then, like I mentioned, that subgroup met, and the subgroup specifically talked about day services. And so that subgroup is, again, a smaller group, and Jays and I. And so we've done some work networking, connecting to other states, really working to target and be intentional with finding a solution, a long-term solution to some of the flexibilities that's currently in Appendix K. So that group has been doing a lot of work and putting in quite a bit of time. Some of the next steps for that work is making sure that the information that was submitted to providers pre-COVID, that will all be resubmitted with clear expectations moving forward. And that will also include, I believe, a guide was previously submitted, and so that will be included as well. And I think that's what I have. Jays, what did I miss?
I'm just looking through my notes, and I think you covered everything. Ultimately, again, just highlighting that we have until March of 2023 to be in full compliance with the HCBS settings rule. So we are working to identify and finalize timelines within that ultimate end goal date of March of 2023 to make sure that we don't have any issues when it comes to compliance with the action steps that we identified in our statewide transition plan.
And then on brief, just quick glance of who is participating in today's meeting. There are a few of you that are a part of this work group. Do you have anything that you'd want to add as far as that work group coming together and focusing on H2BS settings specifically? Okay, I won't call on you. But if you have anything to add, please know that there's as with all the work groups, great stakeholders working to make sure that we have a good system set up for H2BS settings assessments.
Okay, so I'll talk a little bit about the roles and responsibilities work group. This group has met, I think we've met probably six times. And so we've made a lot of progress. And so this will be one of those updates that I won't necessarily be able to go into great depth and detail, but we will be, we're reviewing section by sections, we're identifying updates, we're clarifying and reorganizing each section as we go. We've had really good discussion from work group members with recommendations to add details, things that have been learned over the last several years, things that have been a little unclear. So hopefully the finished product will be a better resource moving forward. The work group has discussed and we have a plan to identify and establish any additional guidance or training for changes or additions that we make as we go. And the changes will not be effective until the document is completely finalized. And we've done some of that guidance and training and provided some of those resources. So I'll provide a really brief update on each section we reviewed so far and kind of one highlight or notable change in each section. So we first we started with the medical section, and we have added some expectations about the responsibilities when a person or their guardian has chosen to not have the CSP manage their medical care and medications, and some of the responsibilities that are still in place for providers to ensure health and safety. So we have clarified that, and that will certainly be something that we'll need to work through more procedurally as we move forward. In the financial section, we have made some distinction between personal finances versus representative payee responsibilities. And so we're clarifying the role related to the completion and submission of those eligibility related documents, like, the Social Security. There's a rep payee report. Obviously, a rep payee would do that. But if the CSP is not the rep payee, clearly they won't do that. Submission to like economic assistance. If the CSP is the rep payee, then they'll be responsible for that. So things like that we're clarifying in the financial section. We have talked about point of entry, and this is something that we'll continue to revisit. So to give a high level overview, and we'll provide more information during the stakeholder collective meeting in July, DDD is working towards creating a single point of entry for our service system. And so updating this section is a little bit tricky because we're navigating sort of the current reality with what we would like to see as a single front door to services, with DDD as the point of contact for application and eligibility determination. So we've revised it really to reflect the current practice, knowing that our goal for that single point of entry is a longer term goal. But so we're providing continual monthly updates as we work through the document on that. We have discussed significant change requests, which we will be soon renaming service change requests, because it's not about a significant change, it is just about a service change. And really our goal for consistency, I know the SCRs have been a major pain point over the past 5 years and probably even before that, but just really want to get consistency in how those SCRs are initiated and submitted to DDD. And so we coordinated with the existing SCR work group, and we have determined that SCRs must be generated by the case manager, who is the facilitator of services for that person. And so I know that that has been each CSP has worked with case management to do that in their own way, but we will be requiring that that happens in a consistent way moving forward once the roles and responsibilities document is finalized. So again, there will be some kind of logistical and procedural issues that go into that change. We have reviewed the discontinuation of services in the document as it currently is. Participant initiated and provider initiated discontinuation is all in one section. So we separated out each type, and we added a lot of detail regarding the form numbers and the timelines, and what is required and when for each situation. And we have added some sections. So for example, when we reviewed discontinuation of services, the topic of reduction of services came up. And so we've added a section specific to that. We've added a section specifically for supported decision-making. We've added sections for extended absences up to and beyond 90 days. So there it's clear regarding who submits what and who can bill for what when a person is absent from services. We've added citizenship, referrals to community services and supports. And we haven't filled the section out yet, but we have a placeholder for the NCI in-person surveys on the document as well. So like I said, we're making really good progress. And so I know that Cheryl Rolfe and Laura Wendland had agreed to kind of pitch in and share their perspective as well, but I would welcome any other work group members who would like to share their perspective for the next couple minutes.
Julie, can I ask a question? It's Mel. I'm sorry, I missed what you said about the point of entry changes. What did you say about the point of entry?
So at DDD, within DDD, we have been trying to set the stage for, well, we haven't been trying, we have been setting the stage for us to have the capacity to act as a single point of entry to DD services. And so knowing that we have limited time today, we do have a plan to talk in more detail about that during the July stakeholder collective, but essentially application for services and the determinations of eligibility would happen within DDD, and then referrals for services would go out to case managers and then to CSPs. And sometimes that would happen simultaneously, of course, as it does now. But really hoping to streamline that process to make it a bit simpler for families, self-advocates, and our partner agencies as well. And that would also give us an opportunity to be able to much better to improve our tracking for growth and knowing where referrals are coming from, and be able to project for the future. Does that help?
Yeah, it does. I think just something to consider. It doesn't happen as often as it did prior to conflict-free case management, but it does still happen when you have entities or parents or family members that are calling that need help immediately. And, it's very difficult to give them a phone number, knowing that we're not that point of entry anymore. So that might just be something that you want to discuss during that time.
Yeah, definitely, definitely.
We have a question in the chat box going back to SERs. It says, SERs are initiated by the CSP. All the CM does is sign it. This is from Shirley.
Yes, but that is something that our group has discussed pretty in a lot of detail, and we had some debate over it. Essentially, moving forward after once the document is finalized, and we provided some training, and we are coordinating with our SCR work group, which does consist of case management agencies and CSPs as well. Those documents will be initiated by the case manager. Like I mentioned, the case manager is responsible for knowing which services the person is receiving, and if there's a change, why that change is occurring. And so without going into the entire discussion, although there are meeting minutes available on the provider portal, if you want to kind of see what some of those discussion points were, you can certainly review that, Shirley, but it's really important that the case managers are knowledgeable about the person's services and supports. And so them being required to initiate that process ensures that they are included and informed and are helping the person drive the services.
My concern is that the timelines of the conflict-free case managers doing that and us knowing what is going in, I think it needs to be both. I mean, we need to be able to see the significant change requests that are going in. I mean, at this point, we don't know if they've signed it after we've sent it to them. And then we find out, you know, a month later, it's still sitting somewhere. So I think it's a major issue because the funding affects us, not them.
So there will still be a similar process in that the CSP will sign off on that. And actually it will initiate with the case manager, the CSP will sign, and the case manager will submit.
Julie,
Yeah.
when you were describing it, I knew I worried that would flag that. You talked a little bit in the group about a system or something that's going to give more information that will help in this process so that it's transparent and viewable by both parties. I just don't know what it was called. Yeah.
Yeah, so DH21 is the system that we use for rate setting and service-based rates and, you know, generating CSAs and all that fun paperwork that you all get every month. And we're hoping that in August, providers will have access to that. And we are working with our tech people to get the SCR integrated into DH21. And so hopefully that would streamline that process significantly.
Does that help, Shirley?
Sure, but it really, not really, but I guess I'll wait and see how it all turns out.
We have one more question in the chat box. I know the CMs that New Horizons works with CCs us in on the email they sent to Jenny and the DDD. I also instruct New Horizons CMs to CC the CSP when they send to the DDD.
Yeah, that definitely has been identified as a practice, but it seems from our discussion that it doesn't happen consistently, which again, consistency is our goal. And so, you know, this is where we've landed on that particular topic. And we recognize that it will, it'll change some practices and procedures at various providers. We recognize that. And so we're here to support through that. We're working to take measures to streamline the process so it is less painful for all parties involved. Okay, any other questions or comments? And how are we doing on time, Donna?
We're ahead of schedule, so we're doing good.
Oh, excellent. How did that happen? All right, anything else? Laura, Cheryl, anything else that you would add?
No, Julie, I think you covered it. I was just going to bring up the DH21.
Okay. Yeah, I appreciate you guys mentioning that because that kind of went off my radar. Okay, well, with that then, I will turn it over to Jays to talk about agency with choice.
Alrighty, so for those providers that maybe aren't as aware or aren't in the family support realm, a quick overview within agency with choice in family support. There was recently a change made to limit the number of hours that providers that are hired through the agency with choice model in family support are able to work each week. And of course, the concern being with that had to do with liability and covering benefits for those employees if they were to exceed a certain hourly threshold in relation to the Affordable Care Act. So through that, we have developed an agency with choice work group to continue to work towards a possible long-term solution when it comes to balancing the requirements of the Affordable Care Act as well as the needs of the participants and families on our system. As we know, there were a good chunk of families that were impacted by this change and their providers. So the agency with choice providers and Family Support Council subcommittee came together to meet in our agency with choice work group and discuss concerns with the changes that were made to the agency with choice model. We talked through some possible solutions and the idea of reforming the model. Some of the things that we've looked to as an example would include the ADLS waiver, which is within the Department of Human Services and how they operate their agency with choice model. And so we talked that through as a group. Ultimately, of course, our Family Support Council is responsible for advocating to the division on changes that would impact family members across South Dakota. And so they are very concerned and would like to see a viable solution to this change that was made, as they do not feel like the 20-hour-a-week threshold is able to meet the needs of several of the families on the family support program. So we gauged the interest of our current agency with choice providers on making the changes to the model that we had proposed to ultimately comply with the benefits concerns, as well as possibly make some improvements to the family support waiver, just from in general what we've heard from families on the program when we've gathered feedback either through various listening sessions or through the Continuum of Care report. And so ultimately, as a result of the last work group meeting, we are continuing to explore all possible options when it comes to how we operate our agency with choice model. We are engaging in conversations with providers who could, who are either delivering the agency with choice as it is now, or providers who might be interested in becoming an agency with choice provider. And we are looking to determine a long-term solution to how the agency of choice model is currently operated within the family support waiver. Ultimately, we're still kind of in the discovery phase. So the next work group meeting has not yet been scheduled, but ultimately the family support waiver is also up for renewal. And that is due by March of 2022. So we just kind of have that timeline in our head when it comes to how we are operating agency of choice within the waiver. That is what I have on that. Are there any questions? All righty, I will pass it off to Augusta on the shared living work group.
Yes, thank you. The shared living work group has met 2 times. The work that we have done so far is examined the shared living guide that was released in 2018. And we have made proposed updates. We will be meeting a final time this coming Friday, an in-person work group, and we will be addressing any proposed rule changes and kind of finalizing the work on the guide and making sure that expectations in terms of eligibility for the shared living service is clarified. Joey, is there anything else that you can think of?
Has the in-person meeting been changed from the 25th to this Friday?
Oh, I'm so sorry. Next Friday, the 25th.
No, Gus, I don't have anything additional. I would just say, again, this work group, we've had pretty lengthy conversations as you can imagine, as we've updated the guide. For those of you who might not know, the shared living guide was last updated in 2018, I believe. And so there was quite a bit of updating that was needed, revisions made to that. So we've done a lot of that. Work group's done a lot of great work there. And then again, as Gus indicated, we are meeting in person in Pier on the 25th, so next Friday, where we're going to look just specifically at the shared living rules and identify any potential revisions there. Again, that also ties to the annual rules review that we are doing. So anybody, I think I've seen a couple people who are part of that work group. So anything that those participants would want to add that Gus and I maybe inadvertently overlooked. Okay, hearing none, then I believe I am next with the rate methodology. So at this point, you likely know that we have contracted with Guidehouse to facilitate the rate review work. Our focus right now remains compliance with Senate Bill 147. Our structure for the rate review work is slightly different than how it maybe was addressed previously. So there is a work group which is made up of largely the same group of people who were part of some of the previous financial discussions, in addition to some new members, of course, because of turnover and whatnot at provider agencies. But by and large, that is a provider work group. And then there's also a steering committee structure. So the provider work group will be the work group that Guidehouse assists with really getting into the data and the weeds of it all, making the recommendations for any potential changes. And then those will go up to the steering committee. So like I said, the provider work group is individuals who had been identified as interested in that work group, as well as our partners in DSS. And then the steering committee will be our administrative staff from DHS, DSS, and legislative representation. So that is how that process will work. I believe if you are a part of that work group, you would have received an invitation for the kickoff meeting, which will be virtual next week. I believe it's the 24th, somebody correct me if I'm wrong, for that work group. So the steering committee will be meeting the following week after that. And certainly for CSPs on the call, Dan is the liaison between the two groups for the CSPs. So he will be able to keep everybody up to date in that work as well. Any questions on rate review work? It's just kicking off. As you can imagine, that project plan is a very, very tight timeline. We are required to have an annual review of the rate to ready to be presented to legislators in November. So that is the tight timeline we are working on.
Joey, this is Dan. So then the provider, like the provider work group that we have right now organized, this is just to clarify, we're going to be working directly with Guidehouse and going through all the details of the whole model and everything like that. Then that information then goes to the steering committee.
Correct.
And then that's like reviewed by them, or?
Yes.
Okay. And that's
So
DSS.
that means
Okay.
all the detailed of the conversation is what's going to happen in the work group. And then the high level things, the things that the higher level administrative staff need to know is what will be presented at the steering committee.
Okay. All right.
And
Thanks. I just
yeah,
wanted to clarify it.
yes. And then you, Dan, as the ED for the association, and then our partners at DSS will sit on both of those committees.
Okay.
Any other questions? I will say that our project manager for Guidehouse is also working with Wyoming. And so is pretty familiar right now, just with their structure was very similar to ours prior to some of their rework. And so we are fortunate that he has a good understanding of South Dakota as well, due to some additional work that they have done with DSS. So other questions? Otherwise, I'm going to turn it over to Julie. Okay.
Okay, so we are running a little bit ahead of schedule. I will kind of go through this and then maybe open it up for any other questions or topics or things. Because after this, we really only have about 5 minutes of topics on the agenda, really just planning for the next session. But just wanted to point out that our group will not meet in this specific group in July. We will be doing another DDD stakeholder collective. So that'll be the people on this call, CSPs and case managers, as well as our other partner agencies like the DD Council, Disability Rights, Supporting Families Community of Practice. And so we'll be bringing that together on July 21st during this same time frame. And then also on July 21st at 7 p.m. and the 22nd at 12:30 Central Time. We will do family and self-advocate conversation sessions again. So I will be sending out flyers for both the collective. Again, that is really for our stakeholder groups, our established stakeholder groups. And then there will be a flyer for the family and self-advocate sessions. And those are targeted for families and self-advocates to receive direct, provide feedback to DDD and for us to provide updates directly to them. So I'll be sending out those flyers in the next few days. If you could please distribute the family and self-advocate flyers through your newsletters, if you have email groups or however it is you all communicate with the families and self-advocates you support, we would really appreciate you helping us spread the word about those. They will be held via Zoom again. And so just wanted to point out those dates. And so the next time this group comes together will be August 18th for our provider stakeholder meeting. So with that, are there any questions about those upcoming events or any other questions or comments or topics that folks want to bring forward today?
Julie, this is John from Vista Care. If I could just run back to the rate methodology real quick for Joey. Do you know, and maybe I need to wait for the meeting, is Guidehouse trying to adopt a new methodology, or are they sticking with the A3 model methodology, and are they looking at whether that, if they are, whether those individual measures make sense, or just update, or just assuming the model and updating the regression essentially?
That's a great question, John. And really it's going to come, it's going to depend on the discussion from the work group.
Okay.
Whatever the work group discusses and makes recommendations for. And Guidehouse is really, they've got the actuary, so they'll be doing any calculations and that type of thing. But ultimately, they won't make any particular recommendations without that feedback coming from the providers.
Okay, thank you.
Yeah.
This is Julie Johnson Drisbeck. I just want to say that I hope you all received the information about the DDD conference coming up September 28th through the 30th at the Ramcota here in Sioux Falls. The registration is open at Center for Disabilities website. We are partnering with them to have this conference. We're very excited, and we hope that you can take a look at that and send some people to the conference. We can talk about that more. Anybody can email me, or we can adjust it next time we meet too, and I can answer questions then. Thanks.
Thanks, Julie. Okay, what else?
Julie, this is Renee O'Connor at SESDAC. The executive order currently allows for overcapacity at group homes through COVID. And I understand that is not being extended. Does that mean that if we have any overcapacity, we literally have to have those people moved before July 1st? Or is there any way to work through a transition?
I would say, Renee, that's some of the guidance that we'll be providing in the next week specifically. But you're right, that is one particular rule that is included in the executive order.
Right. Okay, thank you.
I will say, since I'm telling you right now that it'll be the next week that you get the information, it will not be a flip of the switch. This has to be changed, if that puts you at ease at all.
I trusted that there was some underlying grace there, since the next week is pushing up to June 30th. But yeah, I appreciate that. Thank you.
Okay, anything else from anyone else?
On the provider memo, Julie, where it talks about needing to submit 12 months worth of bank statements, and also cash logs, that's going to be a lot to submit. And I'm wondering, what we have always done is just submitted a year's worth of therapy finance, which obviously matches the bank statements. So will we have to do bank statements instead of therapy finance?
I would maybe need to defer to some of our reviewers. It has been quite some time since I've looked at the therapy, because you use the personal finance module, right?
Correct.
So I would say, if you have not had any issues with citations in your monthly file reviews, that you could continue using that mechanism. And if you have had issues, then maybe, we'll have some discussion offline to work through what kinds of issues and how to resolve those in accordance with that memo. Does that help?
Well, yes, it helps. I mean, we have never had a single citation related to that, with just sending our annual therapy finance statement. So I guess I would just want to know if that could be reflected in that policy memo, then, that 12 months of bank statements or an annual therapy finance statement. Just because based on this memo right here, I wouldn't in good conscience think that I could continue to do my therapy finance report in a smart submission.
Okay.
Based on this memo.
To clarify, Renee, is the content what you are submitting?
Well, the therapy finance module has the exact same thing that the bank statements have in it. So
Okay.
It's the exact same information, but it based on this policy memo, I
So
would.
am I hearing that you
Months of
just
bank
want it,
statements.
am I hearing that you're just wanting it more black and white for it to include any way that it could be submitted to the division?
Yes.
Or saying, and a year's worth of, instead of identifying it, it is a bank statement, or it is a TheraP personal finance, or it is, you want to see a year's worth.
We
of
want to
that
see a year's
person's
worth of,
finance.
we want to see a year's worth of personal finances.
Okay. And I guess I'm going literally with the documents that are named, Joey. And so I think we're saying the same thing. But if I'm looking at this policy memo and reading it literally, I guess I believed that if I have a smart file submission today, I would no longer be able to do my TheraP finance module annual statement. I would need to send 12 bank statements because that's what the policy memo says. But
So I would say if the 12,
content,
if
so.
the 12 months of statements are in TheraP, you wouldn't need to not submit in that manner.
Okay, great. Thank you.
This is Brian in advance. Renee, is that something that you purchased for your agency, or is TheraP Finance available to all of us? I don't remember hearing about it.
We have used TheraP Finance for forever. I think it is open to anyone. But I would defer to Cheryl or someone who knows more about TheraP than I do. But yeah, we've loved it.
Yeah, I believe that it isn't available as part of our oversight account purchase. But that there is a guide out on the TheraP South Dakota website that outlines which modules are included in our oversight account and which
Okay.
would be like add-ons. So that
Yeah.
would be a resource to just to double check.
Okay, I'll do that. Yeah, we use Quicken, but if there's something in TheraP that all those transactions can be entered into, it would make sense to do that. So thank you.
Brian,
Yeah, TheraP Finance is basically the exact same thing, Brian.
Yeah,
won't-
yeah.
it won't reconcile though
Oh, okay.
to the bank. So that's your one drawback. So if someone's putting it in Quicken now, they're going to have to still keep Quicken to be able, you'll have to do some kind of change, system change, or you'll be duplicating your work.
Okay, we'll look into it though. Thank you for the info.
All right, any other questions or comments or topics we have some time to cover? Okay, well, if not, we can get about 15 to 20 minutes back in our day, and I'll turn it over to Jamie, and she'll kind of walk us through our wrap up.
Thank you. So as I listened today during the conversation, I have two things that need to be addressed before or during our next meeting. And one of those being the policy memo with the DH 717. It's talked about just clarifying the annual waiver definition of it, or the waiver definition, making it annually. And the other is the share the crosswalk that Life Course Nexus created. Is there anything else that I missed during today's conversation, or anything else that anyone wants to add to the agenda for the next meeting?
We're supposed to all share for the next collective stakeholder meeting, whatever Julie's going to send us for a commercial.
Okay, missed that one.
Also, Jamie, in that clarification of the 717 memo, it was also to clarify the documentation for personal finances, the bank statements versus the TheraP financial module.
Thank you. So beyond today's conversation, is there anything in addition? I see on the agenda, Julie has the service support section of the ISP as a possibility for the next agenda. Is there anything else that anyone else would like to see on that?
And I would just maybe ask and kind of add on to that question. You know, we provided a lot of work group updates today. Was it helpful to provide an update on all the work groups? Do you have any thoughts on kind of, you know, do we want to see this repeat again in August? Would it be helpful to provide some updates in August and then in a little more depth and detail if possible? What are your guys' thoughts about how today went? And we extended the time, so.
Julie, this is Dan. I like the updates. I don't get a chance to participate on all of those work groups, as do probably a large number of us. And so, you know, at least getting some information is good. I realize that I think you said that the notes are on the DD portal on your website, I think. So, but I don't know how quickly, you know, we can all get to those notes. So having the, you know, the update is very helpful. I feel anyway.
Yeah, this is Brian Ardrey. I was just going to share, I learned a lot today. I thought that was good. And whether it's fewer but more in depth or the same, I would be okay with either, but I think doing this was good.
Okay, well,
I think Julie, that just personally, like, would be probably good to break them up. You know, if we did half of them one time, half the other time, because I think there are a lot of questions that maybe people didn't ask because we were worried about time. So it might be okay to, you know, break the groups up in half to go more in depth and allow more time for questions.
Julie Peterson has something in the chat.
So it says, so if I understand everything correctly, in August, CSPs will be able to see the individual service records also through DH21. And yes, that is the anticipated timeline, barring any delays with our technology partners. I would say that is our hope. Okay, so we will continue with the updates, and then I'll follow up with the person who sent the suggestion for the service support section of the ISP, or kind of dig up that. I think it came through in an email, just to make sure that we have some context and we are able to clearly communicate what the questions are and what we want to get out of that agenda item. And carry forward the work group updates and anything else that kind of comes up in between. And of course, if you think of things, certainly send them to me and we'll get them added. Okay, with that, I think that brings us to a close for today. I appreciate everyone's questions and feedback and participation. We'll end about 15 minutes early and give you all some time back in your day. Thanks, everyone.
Thank you.
Thank you.